Hi, I will be talking about the nursing considerations and prognosis of patients with leukemia. With our nursing considerations, we can talk about, you can use the nursing process, and we can have subjective data, and we can have objective data as well. We can look at the history and physical of the patient, see if the patient has anything besides leukemia that we need to be aware of, if they have any other health conditions. We can see if the patient are on any medications, if they have had any recent treatments related to the chemotherapy, such as radiation, such as chemotherapy, if they had a recent bone marrow aspiration. We can see if the patient has any functional health issues as well. In a physical assessment, we can take note if there's any symptoms related to the disease progression, such as say they have poor oxygenation. The patient will usually present to us weak, having maybe being lethargic, maybe having generalized weakness in the body. If they have any bleeding issues related to the leukemia, they may have, let's say, they might have any gingival bleeding. They might have GI bleeding. For females, they might have abnormal menstrual bleeding. These things we want to watch out for. If we were to see their diagnostics, we may see a low or high white blood count. We may see the patient might be anemic. They may have a low HNH. We want to make sure we look at these things and see the findings, see how severe the patient's condition is. When we're planning our care, we want to think a few things. We want to make sure the patient will come to an understanding of the disease and that they will be cooperative with the treatment as well. Now, especially in our pediatric population, we will be in direct contact with the family, so we want to make sure we explain to them as well, and we want to make sure that they also will be cooperative with the treatment. We want to make sure the patient will have minimal complications and side effects from both the disease as well as the treatment. And of course, we want to make sure the patient will have physical as well as emotional support during the treatment phase, during remission, and if they have a relapse, during the relapse phase as well. For our acute interventions, this is an important time because the patient has many physical and psychosocial needs at the time of diagnosis. We want to make sure we do a lot of teaching to the family. We want to make sure that they, if their patient's in isolation, to practice good hand hygiene, entering, leaving the room, or coming in contact with the patient. That if they were to bring food and water, to make sure that it's only bottled water and that there's no raw foods or any flowers that are brought into the room. And if the patient is weak, if they have trouble ambulating, to make sure that they call for help or call for us or for family to assist them so they don't fall, and because we know that they're prone to bleeding as well. So we want to make sure we're an advocate for the patient and for the family as well during this time. And this could continue as they go home. We want to make sure that they take the teaching that was taught to them and that they practice it at home, that is reinforced to them, that they provide return demonstration to us, and that they reach out into the community and use the resources there, the outreach, just other individuals who have leukemia. We want to make sure that they make full use of the resources that are available out there. In our evaluation, we want to see if the patient and family was able to cope effectively with the diagnosis as well as the treatment. We want to see if the patient had little or no complications, and the family and the patient will have support from us and will feel hopeful throughout the treatment. For our prognosis, there are a few factors that affect this. One of them is age. Older patients tend not to fare as well as younger patients with leukemia. If the patient has comorbidities, if they have any cardiac conditions, if they have diabetes, if they have any other conditions, these tend to worsen the prognosis of patients with leukemia. It also depends on the leukemia subtype. Chronic leukemias tend to fare better than patients with acute leukemias. Acute lymphoblastic leukemia and acute myelogenous leukemia tend to have a worse prognosis than the chronic ones. It also depends on the cytogenetic characteristics of the disease as well. That could affect their prognosis. Patients that have leukemia are at an increased risk for developing another type of cancer. This is likely due to the cellular damage that was caused from the radiation therapy, from the chemotherapy. Their incidence, I think I read that there's like a 6% chance of a neoplasm, a different type of neoplasm, within like a 9 or 10 year period after the first initial diagnosis of leukemia for another type of cancer. And so we want to make sure that they're aware of this and that they go in for their checkups and they're seeing their primary care physician very frequently. I attached a little table here on the last page here that will elaborate on the prognosis of different types of cancers. So